Imagine a place where the air is thick with the scent of teak and damp earth, but also with a silent, invisible grief. This is Gadchiroli in 1986. Here, a war was being lost, not with weapons, but with numbers. For every 1,000 babies born, 121 died before their first birthday. In our leadership course, we define leadership as an influencing process between the leaders and the followers intended to achieve organizational objectives through change. In this forest, the organization was the community and the objective was simple survival. But to achieve this, a radical change was required. Most saw these deaths as an inevitable tragedy of poverty, but two young doctors saw it as a leadership vacuum. They realized that they had to change the statistics. They had to change the very definition of who is allowed to lead a life-saving intervention. Meet Dr. Abhay and Rani Bang. They were highly trained at Johns Hopkins, but they rejected the old psychology that leaders are great men born with superhuman charisma. Instead, they embraced a newer understanding that a leader's capacity is determined by context. If leaders are not just those with the right stuff, then they are those in the right place at the right time. The banks identified a paradox. The medical establishment's solution was to build more hospitals, but for a tribal mother, a hospital was a world away. The banks realized that their suitability to lead depended entirely on how they defined their relationships with the people. They decided to move beyond being isolated heroes and instead sought to become a part of the collective relationship that would translate medical ideas into village action. In 1995, the banks triggered what we called a systemic rebellion. They proposed something unthinkable: training illiterate village women to diagnose pneumonia and treat infections. This is the essence of influencing, that is, communicating a radical idea and gaining acceptance for it despite heavy resistance. The old psychology would say that these women weren't born to be doctors. The medical board was furious, calling it dangerous and unprofessional. But leadership is about challenging the status, that is, to continuously improve work processes. Abhay and Rani didn't back down. They knew that influencing and setting objectives is about behavioral change. They weren't just asking for a new health program, they were asking for a revolution in who we trust with the power of life and death. To lead this change, the banks had to develop new innovative products and services. They created the home-based newborn care kit. Look closely at these tools. This isn't high-tech, it's just frugal innovation. Because their followers could not read, they used color-coded scales and pictorial guides. This allowed the village women to identify the signs of death and intervene immediately. This demonstrates a key leadership principle. It's the people that accomplish the objectives. By decentralizing expertise, the banks moved from being the source of the solution to being the facilitators of it. They recognized that a leader's character does not make the leader. Their ability to empower others in this specific context does.
Now let us talk about the relational leadership and psychological safety. Leadership is fundamentally about leading people through relationships. The banks didn't just give orders, they lived in the forest, ate same food and shared the same risks. This is what you call radical proximity. When the medical board threatened the village woman with legal action, the bunks did not hide. They stood as shield, accepting full personal accountability. They proved that a person's capacity to influence others always depends on who those others are. By providing this psychological safety, they allowed these women to feel that they were not only witnessing history but making it. They transformed followers into leaders in their own right, creating a set of special human experiences at heart of effective leadership. Now let us talk about the national ripple. Effective leaders influence followers to accomplish shared objectives. In Gadchiroli, the results were undeniable. Infant mortality dropped by 75% without a single new hospital. This is the ultimate proof of empirical validity. The Indian government saw this data and realized that if it worked in a forest, it could work in a nation. This became the ASHA program. Today, over 1 million women served as the front line of Indian healthcare. Every time an ASHA worker identifies an infection in a remote village today, she is using the leadership framework the bunks established 40 years ago. This is how you achieve organizational objectives through change, by building a system that is stronger than the leaders who started it. Now, talking about global scaling and empirical validity, the final requirement of new psychology of leadership is that its analysis proves to have stronger empirical validity than those it attempts to replace. The bunks research was so robust it was published in the Lancet and became a global milestone. The World Health Organization eventually adopted the Gadchiroli model for the entire world. From Ethiopia to Nepal, the bunks leadership taught the world to stop looking for isolated heroes and start looking for contextual solutions. They proved that innovative products and services aren't always about technology, they are about strategy. They proved that a leader's job isn't to be the smartest person in the room, but to ensure that the room itself becomes smarter. Now, talking about the new psychology of leadership and concluding our presentation, Abhay and Rani Bang are still in Gadchiroli today. They didn't build a corporate empire, they built a Shodhgram, a village of research. They proved that leadership is not about manipulating people, but about motivating followers to support ideas through change. Their story confirms that if character does not make the leader, perhaps the context does. They were the right people in the right place at right time. They are the leaders who proved that the most sophisticated medical technology in the world is not just a machine, it is a woman who has been empowered to care. They didn't just witness the history, they gave a million women the tools to make it themselves. So this concludes our presentation. Thank you.